All right, good afternoon, everyone. Hope everyone had a great lunch, and thanks for sticking around for the last 2 hours of training. So we are going over LTCH public reporting for this session, with pretty much where we're taking all the data you've collected to calculate the measures that will be reported on your confidential reports, CASPER reports, and subsequently public reporting, which is on the Compare website. So the next few slides are the acronyms I'll be using in this presentation, so they are with you for your reference. So the objective of this session is to locate and navigate the Compare website, identify the types of quality measures by data source, and then describe the 3 reports associated with confidential and public reporting, so your CASPER reports. So your review and correct reports, your QM reports, your provider preview reports, and then ultimately the Compare website. So the Compare website is located in the link you see on the slide. You can search for nearby LTCHs by geographic location, so you can type in your city, state, or zip code, and it will output a map for you and display LTCHs within, say, 25 miles from your from the address you put in, up to 500 miles. So. And included in the Compare website are the QM results, which are tailored for the general public. So here's the home page for the LTCH Compare website, where you can type in the zip code, city, or state in the box below. Then you hit search, and then you get various results. So you see to the right a map of nearby LTCHs, and to your left is a list of LTCHs, and it includes the address, the ownership, and the total LTCH beds. And then you can select up to 3 LTCHs, and you can compare the quality measure results among the up to 3 LTCHs. So the measure results page, when you click on a specific provider, for example, it will give you the results for rate of pressure ulcers that are new or worsened. And when you hover on that text, you'll see a more plain text definition. Usually these are definitions for non-clinicians, such as patients, families, friends, and the rest of the general public. So you can see the plain text definition is a much easier, better, a more general interpretation of pressure ulcers. In the table, you'll see in the web page, you'll see graphs, tables on the QM results, which you can toggle through, and it'll give you either the table display, which presents the numerical results, so you have your provider and then compare it to the national results, or you can click on graph view, where you can see a bar graph and compare it to based on a graphical representation. And then below that, you'll see a link to data.medicare.gov. And not all the results are displayed on the Compare website, and there are other results that researchers or analysts in your LTCH that you might be interested in. So you go to this web page and you can download the data and use the data set for your analyses. So some other features of the Compare website, you'll see on the home page, you'll see on the left side the spotlight, which are the announcements by CMS in case there's something new going on with the website. In the middle are tools and tips. Those are various tools you can use throughout the CMS portal. So if you want to compare, let's say, inpatient rehab facilities or skilled nursing facilities, there's a link right there for you to go to the other compare websites. And then to the right, you have additional information. So there's links to a direct link to data.medicare.gov, important contacts, so most importantly, the various help desks in case you have any questions. Alternatively, on the website, on the upper right-hand corner, there is the About link, and you can access more details about your data and the other contacts. So there's many ways to get the other information on the Compare website. Now we're going to talk about types of quality measures. There are 3 types of quality measures. The first is the assessment-based measures. So these are based on the data you've collected in the LTAC CARE data set. The second type is the CDC's National Healthcare Safety Network measures. So any data that you submitted through the NHSN system. And then lastly, claims-based measures. So these are measures based on Medicare fee-for-service claims. So here are the assessment-based measures. So in this session, we will not delve into the calculations of the assessment-based measures, but if you are interested in learning kind of the details on how the items that you filled out in the LTAC CARE data set is used to calculate the measures, you can go to the LTAC QRP webpage, specifically the measures information webpage, and look at the LTAC Quality Measures Users Manual, which is currently version 2.0, released in June 2017. So, but here are the assessment-based measures. So the first is the percent of residents or patients with pressure ulcers that are new or worsen, percent of residents or patients who are assessed and appropriately given the seasonal influenza vaccine. These first 2 are currently publicly reported on the Compare website. And then the next 4 will be publicly reported in the future. So you'll see it. The third one is the percent of long-term care hospital patients with an admission and discharge functional assessment and a care plan that addresses function. The fourth is the cross-setting Impact Act version of the previous measure. The fifth is the application of percent of residents experiencing 1 or more falls with major injury. And lastly, functional outcome measure, change in mobility among long-term care hospital patients requiring ventilator support. The next set of measures are the CDC NHSN measures. You'll see the first is the CAUTI outcome measure, the second being the CLABSI outcome measure, and then the third is the facility-wide inpatient hospital onset MRSA outcome measure. And then the next 3 are the facility-wide inpatient hospital onset CDI outcome measure, your influenza vaccination coverage among healthcare personnel, and lastly, the ventilator-associated event outcome measure, which are only available in the confidential feedback reports, the QM reports, which we'll go over in a bit. And then the claims-based measures, we have the all-cause unplanned readmission measure for 30 days post-discharge from long-term care hospitals. It's currently publicly reported, but it is slated for removal from the LTAC QRP on October 2018. And this measure is replaced by potentially preventable 30-day post-discharge readmission measure for long-term care hospitals. Next is the discharge to community post-acute care long-term care hospital quality reporting program. And then lastly, the Medicare spending per beneficiary, or MSPB, post-acute care long-term care hospital quality reporting program measure. So the first knowledge check. Medicare spending per beneficiary is an example of which type of quality measure. A, CDC NHSN measures, B, assessment-based measures, C, claim space measures, or D, none of the above? And it was in the previous slide, so we'll just, right, then vast majority picked the right answer, C. So, there are a lot of reports in the reporting realm that that are available to you for to look at to review your quality measure data. So these reports include the review and correct reports, the QM reports, and then the provider preview reports. And then we'll go on into detail one by one. So this graphic is a good representation of kind of the whole public reporting process. So make sure to look back and use this as a reference. So you have your CASPER reports, which include your quality measure QM reports, your review and correct reports, and your provider preview reports. And these three reports are confidential reports. And then on the other side, you have the compare website posting, and that's the public reporting part. And you'll see that in the bottom, you'll see kind of a progression from the day that you collect the data, and it will appear on your review and correct reports. And once the data is all, once it's reviewed and corrected by the provider and is no longer, is past the data correction deadline, it will progress into the provider preview reports. And that's when all your quality measure results are frozen and ready to go for the compare website posting. But I will refer back to this graphic, as we go through all these reports. And then the quality measure reports are kind of another way to review your facility's performance on your quality measures. So we'll go over one by one in the next slides. So the first report is the review and correct reports. So these are user on-demand reports. So we'll see later on, you go to Casper and you can select a quarter end date, and it will pop out a report in your inbox. And these reports are confidential to providers. They display quarterly reports. So when reporting quarter ends, the report is available the next business day. So for example, right now we're in quarter 4 2017. So that quarter will appear on your review and correct reports on January 1st, 2018, the day after the end of this current reporting quarter. So when you go to Casper, the quarter end date will appear as quarter 4 2017, and it will appear on the first business day, I think it's January 2nd, 2018, and your quarter 4 2017, along with quarter 1 through quarter 3 2017, will appear in the review and correct reports. These are available for providers to run with updated data weekly until the data correction deadline. So let's say you correct your data today, it will be updated the next week. So don't worry if you correct the data and you don't see it. It will, I think, be refreshed early in the week. And the corrections will be updated into the data correction deadline. So that means that, let's say, quarter 4 2017, the data correction deadline is May 15th, 2018. So if you do a correction, if you submit a correction on May 17th, 2018, it will be submitted, but it will not be updated. Your quality measure calculations will not be updated, because your data is completely frozen. And then the review and correct reports display data correction deadlines and whether the data correction period is open or closed, and we'll see that in the example in a couple slides. And as I said earlier, the review and correct reports are accessed through the Casper system, and these reports provide a snapshot of current performance based on assessments in Casper. And these contain quality measure information at the facility level only, and then the review and correct reports only contain assessment-based measures. These are not risk adjusted, so you'll only see the observed rates in these reports. So providers are able to obtain aggregate performance for up to the past 4 full quarters as the data are available. So as I said before, once the Q4 2017 reports are available, you'll be able to see the 4 full quarters by quarter, and you'll see an aggregate performance below that. Subsequent review and correct reports. So after the first quarter, data for the subsequent reporting quarters are added. So we'll see later on, I'll explain later that, once you see the 4 quarters, the next quarter after that, the new quarter will replace the oldest quarter. So we'll show that. So here is the review and correct reports. So on the top of your screen is the provider information. So your CMS certification number, provider name, address, city, state, etc. The next line is the LTAC quality measure in question, and then the unique CMS measure ID below that. After that is the table legend, where if there's anything that, it's required to read the table. So in this table, a dash means the data not available or not applicable. So in this table, it's divided into several columns. The first column is the reporting quarter. So it goes most recent on top to the least recent on bottom. And then below that is the cumulative row. The start and end date are the specific dates for each reporting quarter. And then the data correction deadline is the deadline for each individual quarter. So for Q4 2017, you see that the data correction deadline is May 15, 2018. The next column is data correction period as a report run date. So it means that if you're, requesting a report today, December 7th, Q3 2017 and Q4 2017 still should remain open, since today's date is before those 2 data correction deadlines. Then the next 3 columns are your quality measure performance. So the first column is essentially your numerator. The next column is your denominator, and then the last column is the observed performance rate, which is the numerator divided by the denominator times 100. And then you'll see that you have quarterly rates and then your cumulative rate. And I want to emphasize that in the last row, the cumulative rate is based on the total number in the numerator divided by the total number in your denominator. We had some questions getting confused with, is the cumulative rate the average of the 4 facility rates? The 4 quarterly rates, but we want to emphasize that's based on the total number below. And then you'll see in example 2, when Q1 2018 appears, which is released on the first day after Q1 2018 ends. So it should appear on the first business day in April. So once that is available to providers, you will see that Q1 2017 in the bottom is missing. It is gone. So you see that pretty much Q1 2018 replaces, is the top, and then Q1 2017 is removed. There's a few exceptions, notably the functional outcome measure, the change in mobility among LTAC patients requiring ventilator support. You have to remember that is an 8-quarter measure. So you will see reporting quarters stacked until you get the full 8 quarters. And once the full 8 quarters are available, then you'll start seeing the rolling quarters for that measure. So just wanted to give one caveat for that. So how to obtain these review and correct reports. So you log into the key system and click on Casper Reporting. And you use your ID and password. So in this interface, you click on Reports on the top, and then you click on LTCH Quality Reporting Program on the left-hand side, and you'll see there are various number of reports, and these are our user-requested reports. So in this example, you click on the LTCH Review and Correct report on the bottom. And then you get the Casper Report Submit page for the LTCH Review and Correct reports. So you'll see right now, you can, if you click on the end date, let's say right now, quarter 3, 2017 is available. The begin date is automatically populated to either a full 4 quarters or how many quarters that is available. So we've only began the review and correct reports on quarter 1, 2017, so just go back to quarter 1, 2017. Once you submit that request, it will appear on your inbox. So you have to go back to folders on the little menu bar on top, and it'll appear on your My Inbox. So, all right. So another way of looking at your performance is through the quality measure reports or QM reports. There's a variety of names that that people refer to the QM reports. They can be referred to as the Casper user requested reports. In the rule is referred to as the confidential feedback reports, but for this purpose, we'll call them QM reports. So these are available to providers prior to public reporting for internal purposes only and not for public display. And this is especially true since these reports do contain patient-level data. So, and these are used for feedback to help providers to improve quality of care. These reports contain quality information at the facility and patient levels for a single reporting period. So, and these reports are available on demand, and providers are able to select the data collection end date and obtain aggregate performance data. And the QM reports for the facility level reports contains all 3 types of measures, but for the patient level report at this time, it is only for assessment-based quality measures. So here is an example of a facility report. So they look a little bit different than the review and correct reports. And you'll see on the top, you'll see on the left-hand side, you see the provider information. And then on the right side, you see the report period. Then the data was calculated on. Below that is the comparison group period. And for this purpose, the comparison group is the national average. So that's one difference between this report and the review and correct reports is that this shows the national average. So you can compare your performance versus the national average for that report period. Below that is the report run date. It's pretty straightforward. And then the report version number, which it's just in case we update the report, it will become a new version. So below that is the table legend. Similar to the review and correct, is used to anything that's used to interpret the table or any various notes that's useful to interpret the table. Below that is the source. So in this case, this is the LTCH care data set. And then on the left-hand side of the table, you'll see the measure name, then the CMS ID, your numerator, denominator, observed percent, and in this report, if the quality measure is risk adjusted, then we also include the risk adjusted rate. And then to your right is the comparison group national average. So you can compare your facility's performance to the national average. So subsequently, you also will receive a patient level report. So the upper left-hand side you'll see is the status legend, which gives you whether the patient is if they triggered the quality measure or not. For example, let's say if you look at the table below, you see that Charles Doe did trigger the percent of residents who with pressure ulcers that are new or worsened. So you'll see that X, the bolded X right there, and that patient was included in the numerator and had a new or worsened pressure ulcer. And then NT means not triggered. So for example, Holly Doe did not have a pressure ulcer that was new or worsened. E means excluded from the quality measure due to various criteria. So you'll see that on the example table that some patients were excluded. And then NA means not available. So for example, Mary Doe was not yet discharged. So you'll see that's why you have an NA for discharge date, and then NA is for the rest of the columns. There's a kind of a special case table where the percent of resident or patients who were assessed inappropriately given the seasonal influenza vaccine is a little different. So how to interpret that is it's a yes or no for the overall measure and the submeasures. So a yes for the overall measures equals yes in one of the submeasures, and no for overall measure equals no in all submeasures. Because to be included in the numerator for the patient influenza vaccination measure, only one of the submeasures need to be included. So you have either the patient received the vaccination, or the patient were offered and refused the vaccination, or the patient had a medical contraindication to the seasonal influenza vaccination. So you'll see in this example table right here, you'll see if the patient had a yes for the overall measure, you see that it's only one Y is required for the three of the other columns to your right. Charles Doe, on the other hand, had no for the three submeasures, so you have the bolded N. And the reason why we bolded some of the little statuses is just to bring attention to the provider that the patient did not receive an influenza vaccine, or the patient had a new or worsened pressure ulcer. So we wanted to bold that to bring attention to providers. And then how to obtain the QM reports. So it's very similar to the review and correct reports. So pretty much log in, and it's the same thing, except for the fact that if you look at the interface, instead of saying Q4 2017 end date, you'll see that it says December 31st, 2017. So it just gives that specific date. And it'll still auto-populate the begin date And then there's another additional field. We don't have a screenshot here, but there's another additional field that says the influenza season date. So it'll automatically populate depending on what quarter end date you put in for the Casper submission system. So, all right, knowledge check. So the review and correct reports provide information for which type of quality measure? Is it A, the CDC NHSN measures, B, the claims-based measures, C, assessment-based measures, or D, all the above? All right, so right. And the answer is C, which most of you have chosen, so great. Then knowledge check 3, which report displays patient level information? Is it A, review and correct reports, B, provider preview reports, C, QM reports, or D, none of the above? Oops. Right. And the majority picks the correct answer. It is C, the QM reports. So to reiterate, so the review and correct reports is just assessment-based measures. They do not include the CDC measures or the claims-based measures. And then only the QM reports provide patient-level information. All right, so the provider preview reports. So in that little graphic that you saw earlier, so this is the report that kind of comes right after the review and correct reports. So these provider preview reports contain facility level quality measure data, and these are automatically generated and saved into your provider share folder in the Casper application, which I'll show you in a bit. This event, so all the information that you see in the provider preview reports will be posted on the LTAC Compare website. And they're available about 5 months after the end of each data collection quarter. So for example, again, quarter 4 2017, the data correction deadline is May 15th, 2018. And it takes about a couple weeks for us to kind of gather the data and put it on these reports. And these provider preview reports are available in the beginning of June of 2018. So once that's once there's the review period, it will eventually a quarter later will become posted on the Compare website. So looking back on slide 19, review and correct reports, provider preview reports, Compare website. So these provider preview reports, as I said earlier, data collection period has ended, so providers are unable to correct the underlying data in these reports. All corrections must be made prior to the applicable quarterly data submission deadlines, or also called the quarterly freeze dates, which falls approximately 135 days, or 4.5 months, after the end of each calendar year quarter. And then there will be a 30-day preview period prior to public reporting, beginning the day reports are issued to providers via the Casper system folders. So you have 30 days from, let's say, June 1st to look at your provider preview reports. And once that 30-day preview period is over, it will not be available in your inbox. So we encourage you all to, once you receive the preview reports, to look over your data. So these provider preview reports include important notes at the bottom, which includes, please review the data about your hospital. emailing the LTAC help desk if you have any questions. And then, various things about, what you see on the Compare website. For example, let's say the titles of the measures are not the consumer language titles that will appear on the Compare website. So, for example, let's say the readmission measure on the Compare website, it is rate of hospital readmission after discharge from LTAC, which is very different from the official and National Quality Forum measure name. So these are the prior preview reports. So this is, you will receive, you'll see in the later slides kind of the, so this is like the text version of this, but essentially it gives the same information. So on the top, you see the reporting period. Then below that is the provider information, and then below that is the table on what information will be publicly reported. So currently, for the pressure ulcer measure, you'll see that it's the denominator, the risk-adjusted rate, and the national rate. So slightly different than what you see on your review and correct reports and QM reports. Below that is the footnote legend used, and if there is an applicable footnote, let's say you had 18 patients on your denominator, then we don't report that on the Compare website, and we place a footnote in place of that. And we'll go over various footnotes in a bit. And below that is your important notes, as I reiterated, which I just stated earlier. So there are various footnotes in these provider preview reports, which are also on the Compare website. So the first footnote is the number of patients stays is too small to report. So for most of the assessment-based measures is less than 20, and for claims-based measures is less than 25. Number 2 is data not available for this reporting period. So either the provider has been open for less than 6 months, there was no data submitted for the measures, so either CDC assessment-based or claims-based measures. So, number 3 is results are based on a shorter time period than required. So I think this is more of a rare case, but if there's a result that has let's say 9 quarters of data instead of 3 quarters of data instead of 4 quarters, then we put that footnote in. 4 is data suppressed by CMS for 1 or more quarters. So, for example, if CMS finds that there's a slight calculation error on the quality measure, they'll temporarily suppress the measure until it gets fixed. 5, data not submitted for this reporting period. So either the provider did not submit any required data, or they did not submit any CDC data to the NHSN system. The next 2 are CDC specific. So 6 is the lower limit of the confidence interval cannot be calculated if the number of observed infections equals 0. So your CAUTI, CLABSI, MRSA CDI measure has this footnote if it is applicable. And then 7, results cannot be calculated for this reporting period. So for this is the predicted number of infections is less than 1. So same 4 CDC measures, CAUTI, CLABSI, CDI, and MRSA. And then lastly, number 8, this LTAC is not required to submit quality data to Medicare because it is paid under a Medicare waiver program. So if your LTAC is under that Medicare waiver program, you'll have that footnote instead. And so this is what you'll receive in your inbox. So similar to this the slide before, but we present to you a more simpler text formatted report. So essentially, on the top you see the reporting period, then your provider information, and then your quality measure data. And then below that you'll have that footnote legend, and then the important notes below that. So how to access your provider preview reports? It's a little bit more simpler than the user requested reports, review and correct QM reports. So you don't have to go to reports and request it. It will automatically be in your inbox. So when you click on folders, it should appear in your inbox, and it'll be in your inbox until the 30-day preview period is over. So there is a process for requesting CMS to review your preview report data. So CMS does encourage LTCH to review data in the provider preview report each quarter. So if an LTCH disagrees with the accuracy of the performance data, so if there's anything wrong with the numerator, denominator, or any calculation error has been done on your provider, then the LTCH can request review of the data by CMS. So request for CMS review of provider preview report data must be submitted during the 30-day review period. So for your quarter 1 to quarter 4 2017 data, which you will receive in June 2018, you have from the day you receive it, so let's say June 2nd, you have 30 days to review that data. And also want to reiterate that you will not have an opportunity to correct the underlying data because it is past the data's correction deadline. So to submit a request, you submit the request to CMS via our LTCH public reporting help desk in the email over there, and include in the subject line your facility name, and then public reporting requests for review of data, and then your CMS certification number. And in the email, in the body of the email, please include the following information: your CCN, the name of your LTCH, the address, the CEO or CEO designated representative contact information, which includes all of that in the slide, and then information supporting your belief that the data contained within the provider preview report was erroneous. So. CMS will review all requests and provide a response with a decision via email. Data that CMS agrees to correct will be reflected with the subsequent quarterly release of quality data on LTCH Compare. So it will be temporarily suppressed, and then subsequently, sometime later, then we'll release your corrected quality data on Compare. And please do not include any patient-protected health information when review data. Just describe the scenario, and we'll look into it. So, all right. So knowledge check 4. Which report displays results that will be posted on the LTCH Compare website? A, provider preview reports. B, QM reports. C, review and correct reports. Or D, confidential feedback reports. Oops. All right. So most of you got it right. So it is A, provider preview reports. Remember, review and correct reports, provider preview reports, Compare website. So all 3 reports associated with confidential and public reporting are accessed through Casper. True or false? Right. Yes, it is true. So they are all accessed through Casper. So review and correct and QM reports are user requested through the reports tab in the Casper system, and then the provider preview reports are in your inbox in the folders tab. Right. Requests for CMS to review your provider preview report data must be submitted via email. True or false? All right. And yes, it is true. Right. The provider preview report provides a blank preview period prior to public reporting. Is it A, 15-day, B, 30-day, C, 60-day, or D, 90-day? All right. And it is B, 30-day. All right. In summary, so the LTAC Compare website is located in that link over there, and there are 3 types of quality measures reported in the various reports: the assessment-based measures, your LTAC care data set, the claims-based measures, Medicare fee-for-service claims, and then your CDC and HSN measures. So again, there are 3 reports associated with confidential public reporting: your review and correct reports, your QM reports, and your provider preview reports, which are all accessed through Casper. And then again, review and correct and QM reports are user requested, and then your provider preview reports are automatically placed in your inbox. So the review and correct reports provide a snapshot of facility level performance at the time to report. So remember, it only contains observed rates and not risk adjusted. It includes your data correction deadlines and whether the data correction period is open or closed. Data are presented by quarter. After 4 quarters, oldest quarter is dropped. And as you know, there's a few exceptions, such as the functional outcome measure, change in mobility among LTAC patients requiring ventilator support, because it is an 8-quarter measure. So, for the QM reports, it provides both facility and patient level information for a single reporting period. And I did forget to mention earlier that when you put in a quarter end date, say December 31st, 2017, it automatically aggregates the current quarter and 3 quarters before, so pretty much a year of data. So if you request December 31st, 2017, it will spit out a report January 1st, 2017 through December 31st, 2017. Forgot to mention that, but it's similar to how the review and correct reports are requested. The QM reports are also referred to as the confidential feedback reports in the rule. And again, claims-based and CDC and HSN quality measures are not included in the patient level reports. And then the provider preview reports, they reflect the data posted on LTAC Compare. Data collection period, by the time you receive your provider preview reports, data collection period has ended, so you're not able to correct the underlying data in these reports. And again, you have a 30-day preview period prior to public reporting, beginning the day reports are issued to providers via your Casper system, your inbox. So, action plan. Please, become familiar with and review your on-demand reports, your review and correct and your QM reports as early in the reporting period as possible. So that way you're not, getting close to the data correction deadline and, not have time to review and correct. Review facility level information to ensure accuracy. And then utilize your results to assist with your quality improvement efforts and ensure data submission accuracy. And then review your provider preview reports well within 30 days to ensure accuracy. So you only have 30 days, so when you receive it, if there are any inaccuracies, you find that your quality measure calculations are inaccurate, you need time to kind of gather that information and send us an email for us to look over your data.